So not everyone needs to see an ear specialist, but it's important to see one if you have possible infection or an abnormal pattern of hearing loss that your primary care can't really pin to. One thing that we see a lot are patients with a sudden hearing loss. Sometimes this can be attributed to fluid or wax at the primary care's office, but it's important to come in if there is an acute change in hearing to make sure that it's not something underlying. If it's something as easy as wax, great. But there is something called sudden sensory neural hearing loss that should be addressed sooner rather than later with steroid treatment, and oftentimes that can be missed in a primary care setting. Another important reason to see an ear specialist is if you have a draining ear that's not getting better with usual treatments, oral antibiotics, for example, for ear infection. Sometimes it really needs to be suctioned out and the underlying source identified and addressed possibly with topical medications. Many times people will come in for the ear and then they're like, oh, you do the throat also. ENT is ear, nose, and throat. Another word for ENT, the fancy word, is otolaryngology. In Europe, they actually say otorhinolaryngology, so it includes the ear, nose, and the throat, but we actually do a lot in between. We do the sinuses, we do the mouth, and just because you're seeing someone for your ears doesn't mean they can't also address other concerns you might have in this area. Definitely not with Q-tips. I have seen many people with perforated eardrums or ear infections that resulted from Q-tip use. Most of the time, our ears do a very good job at cleaning out wax on their own, and a little bit of wax is actually a protective barrier to the skin of the ear canals. If you do tend to build up wax to the point that it's trapping water, causing infections, or affecting the hearing, one option is to come in to see an ENT to have your ears cleaned. Another option is to try over-the-counter drops, which help liquefy the wax so that it can better run out on its own. I do not advise the video cameras that you can buy online because you just don't have the dexterity when you're instrumenting your own ears, and there is a risk of injury with that. Many kids need ear tubes for frequent ear infections. One important thing to recognize about ear tubes is they don't prevent ear infections. So if your child needs ear tubes, they probably will still get ear infections with the tubes, but they're more likely to be able to avoid going on oral antibiotics as often. Another reason for ear tubes is fluid that isn't going away, which may be affecting the hearing in a critical time for language development. One of my favorite things about ENT is the variety of what we see. I see little kids, I see people throughout all ages, and it's nice to have all of those different interactions. There's also a good mix of things that are nice, easy to fix. You feel like you're sending someone out on their way, and then there are more challenging things that really get me engaged and keep my mind working.